You've got the degree, the certification, and the excitement. But before you walk into that first job, there are 7 things you absolutely need to know to protect your license and your sanity. Today, I'm walking you through what to expect in your first job as a psychiatric mental health nurse practitioner, including real-world expectations, clinical documentation, supervision and collaboration, scope of practice, red flags, common mistakes to avoid, how to grow in your first year, and why you should never stop learning. And if you'd like me to make a separate video on documentation, on how to structure your notes, what to include, and the resources that can help you transition safely into practice, please let me know in the comments. I'm happy to break down in detail in a separate video. So let's go back to what actually brought me into this video. Your first job is not an extension of school. During school, you learn theory, diagnosis, treatment plan. But once you're in the field, things move fast. There's no more practice notes. Now your documentation becomes part of a legal and billing record. Now you're managing complex patients, sometimes with little to no guidance. You might feel underprepared at times, and that is okay. Here's the truth. School gave you the foundation. Your first year in practice is where you now start building your clinical identity. This is my little tip that you should stay humble, be teachable, and never be afraid to say, please, let me double check that. That phrase can save you from unnecessary stress and risk. The next thing is documentation. Documentation matters. Documentation is more than just notes. Now it's your protection, your voice, and your professional record. You must learn to write clear and complete psychiatric evaluations. You must learn to document diagnoses with rationale, include detailed treatment plans, med trials, follow-ups, capture safety concerns, risk assessment like suicidal, homicidal ideation, substance use history, use psychiatric specific templates, EMR shortcuts, but avoid copying and pasting without tailoring your notes to the individual patient. My tip is for you to document as if your note could be read in court or reviewed by insurance, or maybe handed to another provider who is unfamiliar with the patient. And again, if you want me to make a separate video where I can walk you through exactly how to document step by step, please, you can leave a comment below. Now let's talk about supervision, collaboration, and independence. Whether your state requires supervision or not, you should not be practicing in isolation as a new grad psych NP. You need a collaborating psychiatrist or experienced NP who is open to mentoring you. You need a team that values input from nurses, therapists, and case managers. You need regular case consultations, even informally, to improve your clinical thinking. If you're offered a position with no oversight, no support, and no onboarding, that might be a red flag. Please remember, the next thing is, please remember, do not practice outside your scope of practice. Just because someone asks you to do something doesn't mean you should. You must know your state scope of practice laws. Check with your state board of nursing on what you're legally allowed to do under your specific specialty. Understand that not all providers or administrators understand what a PMHNP can and cannot do. You may sometimes encounter employers who ask you to work without supervision in a state that requires it. They might ask you to work in settings that expect you to manage patients' populations you're not trained for. You might encounter colleagues who confuse your role with other professionals. Just because you're credentialed doesn't mean everyone knows your scope of practice. Remember, you are your first line of protection. A tip is to ask about supervision, patient load, and orientation before accepting a position. If they say, oh, you figured it out on the job, that's not a healthy learning environment. Here's what many psych NPs face in their first year. Number 1 is imposter syndrome. You might ask yourself, am I really ready for this? Many new psych NPs struggle with feelings of self-doubt, especially when they begin practicing independently. You might think, did I really learn enough in school? Am I going to make a mistake? Do my patients or colleagues think I'm competent? This happens because you've gone from being supervised in clinical rotation to being the patient's primary provider. That shift in responsibility can feel overwhelming, especially when you compare yourself to more experienced colleagues. So what can you do? Remind yourself you're new, not unqualified. Normalize the learning curve. Confidence grows with repetition. Seek mentorship and case consults to validate your clinical judgment and get feedback. Celebrate small wins. Every well-managed follow-up or accurate diagnosis count. Another thing you will face is heavy documentation. Charting takes longer than you think. You quickly realize that documentation can take a large chunk of your time, especially early on. Your notes need to be legally sound. Your notes need to be billable, clinically useful, clear to other providers. The reality is what took you 10 minutes to jot down as a student can now take 30 or more minutes because now your notes carry legal, ethical, and billing weight. So what can you do to help with this situation? Use templates or EMR macros for efficiency, but personalize every note. Build a documentation checklist for yourself. Try to complete your documentation right after the patient visit while the details are still fresh in your mind. Don't aim for perfection, aim for completeness and clarity. Another thing you might face is being viewed only as a prescriber. Remember, you're not just there to write scripts. In some settings, psych NPs are treated as med managers with back-to-back 15 minutes med checks and no time for a therapeutic dialogue with a patient. So why does this happen? Some clinics are understaffed and employers may not fully understand the PMHNP scope, which also includes comprehensive psychiatric evaluations, psychoeducation, therapy, collaborative care. So what can you do? You can advocate for appointment lengths that allow for meaningful patient interaction. Educate your team and patients on your full scope of practice. Integrate short therapeutic techniques like CBT, motivational interviewing, into your follow-up visits. Another thing you will face is managing high-risk patients. You see patients with active suicidal ideation, manic episodes, psychosis, or complex trauma. Knowing how to respond is critical, not just for the patient's safety, but also for your confidence and liability. Common fears and questions you might ask yourself are, what if I miss something? What if these patients harm themselves after our session? Am I legally responsible? So what can you do? Know your clinic's emergency protocol, like crisis team, 911, psychiatric inpatient referral process. Always document risk assessment like suicidal, homicidal ideation, plan, means, protective factors, referrals. Don't hesitate to consult with your supervising psychiatrist or refer out where needed. Use tools like, for example, the Colombian Suicide Severity Rating Scale when unsure. Another thing you might face is scope creep. Scope creep happens when you're asked or expected to perform tasks beyond your training, your license, or legal scope. Practicing outside your scope can lead to legal and ethical consequences and put your license at risk. So what can you do? Know your state Nurses Practice Act and Board of Nursing Regulation. Have a printed copy of your psych NP scope of practice for reference. If you're asked to do something questionable, you can simply say, I want to make sure I'm practicing within my license scope. Let me clarify this with my state board of nursing or collaborating physician and get back to you. Advocate for appropriate training and clear protocols. The tip that I share is learn your limits and protect your license at all costs. And another advice I'll give to any healthcare provider is never stop learning. One of the most important pieces of advice is to never stop reading. Don't stop learning. Why? It helps you stay up to date with evidence-based practice. It also builds confidence in your clinical decision making. It makes you a safer and more effective provider. And it can also help you grow beyond the role of a new grad faster. Whether you are reviewing psychopharmacology, attending CEU webinars, or following trusted guidelines, your continued learning is what sets you apart. You can join online communities, ask questions, attend trainings, keep the momentum going. Your first job may give you experience, but your growth comes from your commitment to keep learning. Being a psych NP is a meaningful and powerful role. And your first year will be filled with lessons, challenges, and real victories. So just a quick rundown: know your scope, ask for mentorship and support, prioritize documentation. Make sure that you're documenting rightly. Protect your license and never stop learning. So please drop a comment below. What are you most excited or nervous about as a new grad psych NP? Or if you're already practicing, what advice would you give your past self? If this video helped you, please don't forget to like, subscribe, and share with a fellow psych NP. I am Dr. Georgette Kui. See you in my next video, and thanks for watching.